All right, everyone, welcome back. Today we're diving into a topic that might make some folks a little uncomfortable.
Yeah,
Erectile dysfunction.
you got it.
But look, it's nothing to be ashamed of.
Hmm.
We're all adults here, and we're approaching this as part of a larger conversation about men's health, because that's exactly what it is.
Right.
We've got this awesome guide chock full of practical advice, so let's jump right in. First off, let's define what ED actually is. I mean, we all have a general idea, but let's get specific.
Yeah, so you're right. It's more than just the inability to,
Get it up.
to get or keep an erection firm enough for sex. We're talking about something that can really impact a man's life. Confidence, relationships, even his mental health if it's a persistent problem. And it's super important to remember having trouble from time to time, it's totally normal. Happens to everyone.
Oh, yeah, for sure.
But when it's a recurring thing, that's when we need to take notice.
Yeah, I feel like a lot of guys brush it off, like, it's no big deal. But it really can affect so many areas of their life. It's all connected.
100%. Now, when we talk about the causes of ED, that's where things get really interesting. It's rarely just one thing. Usually, it's a mix of physical and psychological factors all coming together.
Okay, so let's unpack that a little bit. What kind of things are we talking about on the physical side?
All right, so think of it like this. To get an erection, you need good blood flow. Right. So anything that messes with that flow becomes a potential suspect. Cardiovascular problems like blocked arteries are a major culprit. Imagine a traffic jam in your blood vessels, not good. And then you've got diabetes, which can actually damage those blood vessels, as well as the nerves. That can really impact sensitivity. And of course, we can't forget about hormones. Low testosterone can seriously tank your libido. It's like trying to drive a car with an empty gas tank. It's just not going to go anywhere.
Right, and that's a connection I feel like a lot of guys just don't even make. They think it's all in their head. They don't realize those physical issues can be playing a role.
Which brings us to that psychological component. Our minds are incredibly powerful. Stress, anxiety, it's like stage fright, but for sex, right? That performance pressure can totally mess with things. And let's not forget about depression. It's really common for folks with depression to have a reduced interest in pleasurable activities. And yes, that includes sex.
Yeah, it's almost like your brain is slamming on the brakes.
Yeah.
But what blows my mind is that even if a guy is eating healthy, exercising, taking care of himself, he could still struggle with ED.
Absolutely. It's a complex issue, and it's not always so straightforward. Relationship problems, for example, can create a lot of tension, and that tension can actually manifest physically. Unresolved conflicts, poor communication, it all takes a toll.
So how would a guy know if these factors are at play? What are some telltale signs to watch out for?
Well, having difficulty getting an erection in the first place, that's obviously a big red flag. It could be related to blood flow problems or those psychological issues we were talking about.
Makes sense.
Then you've got trouble keeping an erection, maintaining it. That could indicate stress or even point to some underlying problems with blood vessel health. And lastly, there's a decrease in interest in sex overall. Could be a sign of a hormonal imbalance or even something like depression.
Okay, so let's say a guy notices these signs. What can he do about it? I mean, everyone always jumps to the little blue pill, but it's got to be more than that, right?
You're absolutely right. It's not just about popping a pill and calling it a day. True sexual wellness is a holistic thing. It's physical, emotional, and relational. They all work together.
Like a three-legged stool. You need all three for it to stand strong.
Exactly. So let's start with nutrition, because what you eat has a huge impact on every aspect of your health, including sexual health. Leafy greens like spinach and kale, they're packed with nitrates, and guess what? Those nitrates convert to nitric oxide in the body. And nitric oxide is essential for relaxing blood vessels, and boosting blood flow, which we already talked about, is key for getting and keeping an erection.
Wow, I never knew that about spinach. It's like nature's Viagra, huh? What else should we be loading up on?
Fruits, watermelon, berries, they're fantastic for blood flow. And then you've got nuts and seeds, like almonds and sunflower seeds. Those are packed with vitamin E, which helps keep those blood vessels healthy and functioning as they should.
It's amazing how powerful our food choices are. And of course, got to mention exercise, right? Can't forget about moving our bodies.
Absolutely. Physical activity is like giving your whole system a tune-up. Aerobic exercise, anything that gets that heart pumping, not only improves your stamina, but also boosts circulation. And here's one that might make some guys chuckle a little bit. Pelvic floor exercises.
Yeah. Those are the ones that sometimes get a little giggle, right?
Yeah.
But they're important.
They're so important. Those muscles are actually vital for controlling erections, and strengthening them can make a real difference. So yeah, maybe a few giggles at first, but in the long run, it's worth it.
So we're really talking about a full mind-body approach here.
Right.
What about the mental and emotional side of things? What can guys do to address those aspects?
Stress management is huge. Mindfulness, meditation, yoga, those tools can really help quiet the mind and ease performance anxiety. And if you're dealing with deeper issues, don't hesitate to reach out to a therapist. Addressing things like anxiety, depression, even relationship challenges, it can have a ripple effect on your sexual well-being.
Yeah, that makes total sense. It's all connected. And while we're on the subject of positive changes, we've got to talk about ditching those bad habits.
Right, 100%. Smoking. It's like putting up a big old roadblock in the way of good blood flow. And limiting alcohol intake is key, as excessive drinking can actually hinder performance. It's all about creating an optimal environment for your body to function at its best.
Right. Got to treat it right.
Yeah.
So we've talked a lot about lifestyle changes, but let's shift gears and talk about medical treatments. What kind of options are available?
There are a bunch of different approaches out there, but the most important thing is to consult a doctor to figure out what's best for your individual situation. Now, you mentioned the little blue pill. Those are oral medications like Viagra and Cialis. They're probably the most well-known options. They belong to a class of drugs called PDE5 inhibitors. Basically, they help relax the muscles in your blood vessels, leading to, you guessed it, increased blood flow to the penis.
Interesting. So there's actual science behind it. It's not just magic.
Nope, definitely not magic. All right, now if low testosterone is a factor, hormone therapy might be recommended. Then there are vacuum devices, which use a mechanical approach to draw blood into the penis and create an erection. And then, for more severe cases, surgical options like penile implants are sometimes considered a last resort.
Wow, a whole range of options. But at the end of the day, I think the most important takeaway from our deep dive is that ED is not something to be ashamed of. It's a treatable health condition, just like any other.
Couldn't agree more. And that's why open communication is so crucial. Talk to your partner, talk to your doctor, and most importantly, talk to yourself. Breaking the stigma starts with honest conversations.
Absolutely. We've covered a ton of information today. It's clear that ED is incredibly common, treatable, and that achieving sexual wellness is totally within reach for any guy out there.
And remember, this deep dive was all about giving you the knowledge. But the next step is taking action. Take what you've learned and start a conversation. Whether it's with your doctor, your partner, or even just with yourself, that first step can lead to a world of positive change.
So true. And don't forget, taking care of your sexual health can have such a positive ripple effect on your overall happiness and well-being. So be proactive, take charge of your health, and embrace a more confident you. That's it for today's deep dive. Until next time, stay curious.
Just see ya.